Hello, guys. Welcome to my channel. My name is Blandina. I am a registered dental hygienist and therapist working in England, UK. Welcome to my channel. I am glad you're here. Today's video, I really want to speak about how I became a dental hygienist and therapist. I had never heard about what dental nurses do, what the career involves, but the career officer is the one who really told me about dental nursing. And the more he explained to me what dental nursing was, the more interested I became. So he explained everything, what they do. They assist the dentist in looking after the patients. When dentists are doing their fillings, they need someone to help care for the patient, suction and get the water out and all that sort of thing. And I just became fascinated. So I thought to myself, yes, I really want to do this job. I really want to be a dental nurse. I looked it up and that was it. That was my way into dentistry. Once I'd made up my mind that I really wanted to be a dental hygienist, the first thing I did was ask my practice manager if I could shadow the dental hygienist we were working with. And every time I was free with my dentist, I would ask him if I would go into the hygienist room and really shadow her, nurse for the hygienist. And she was really helpful as well in opening up, telling me what I needed to do. And again, what courses, any advice she had, I really took seriously. And again, my dentist was really helpful as well. And he also let me give some oral hygiene instructions to patients, do some toothbrushing instructions with older patients and children as well. And I enjoyed that. And I think that helped me to gain confidence talking with patients on one-to-one when I was giving them oral hygiene advice. In terms of courses, I looked at developing my education and I looked into nurses for dental nurses. So I did the course on oral health promotion. And during this course, I really enjoyed it as well because during the course, I had again to give oral hygiene advice to patients. I had a portfolio that I had to fill in, a certain number of patients, different kind of advice that was done and was all documented. So again, this was helping me gain that role of writing my own notes, treating patients, and I like that at my practice. They were very helpful. They started giving me slots for oral hygiene advice, and again, because of the course, we had to do that to make sure you qualify and you pass your training. Was one of the requirements for the oral health promotion course for dental nurses. So I would advise that look into courses if you really want to be a dental hygienist and you're already working as a dental nurse in a dental practice. Do shadow a hygienist, find a mentor, and that would really be helpful because it'll give you an insight on how a dental hygienist works, and you'll be able to tell if it's really something that you want to do or not. But shadowing a dental hygienist really opens up a lot of opportunities for yourself. And again, you're working one-to-one with her, you'd be able to ask all the questions that you have. So yeah, do try find a mentor, find a hygienist you can shadow, you can work with, ask them as many questions as you can, just to make sure this is really the career you want to do. And if you can do it on a daily basis, and you'll be happy, you'll be satisfied with the job, because this job is really a people's, how can I put it, it's a people's skills job. Communication needs to be really good. You need to be someone who's happy talking to patients, talking to people, because you'll be seeing patients all day long, and you need to be able to gain your rapport with your patients and communicate with them. You need to be able to be compassionate. You need to be kind to your patients. You want to be able to treat them with dignity, with respect. And again, you need to be able to understand from their point of view. It needs to go both ways. If your patients open up to you, then you'll be able to understand more where they're coming from and really develop a very good relationship with them. So it's definitely a people's job. You want to be in front, you're seeing patients all day long. So definitely you need to be friendly. You need to be someone who's easygoing, who's able to communicate and things like that. And getting on a course, there's so many courses that you can do as a dental nurse to prepare yourself. You could do like I did the oral health promotion course. You could do the taking impressions for dental nurses. You could do, again, radiography for dental nurses. All these courses will help you as you're qualified, as you're looking for qualifications, courses as a dental hygienist. These are some of the modules that we will do in your dental hygiene, dental therapy training anyways. So again, it just helps when you're going for your interviews. It just helps the interviewer to see that you're someone who's really interested, someone who's really looked into the modules of dental hygiene. You're already starting to get yourself prepared, even though it's on a basic level, but at least it's showing that it's someone who's really interested in education, and also that you haven't had a very long break in your education. If you have, then I would really recommend doing a few courses just to show that at least it hasn't been a very long time that you've been in education. So this is what I did to prepare myself to become a dental hygienist. So I worked as a dental nurse for 4 years, and after 4 years, then I was able to apply for dental hygiene training, and luckily enough, I was successful. My interview was really nerve-wracking, because when I went for the interviews, I knew there was going to be a lot of people on the panel, but again, just walking into the interview and seeing four people waiting for you, even though I was aware, but when you see it, when I saw it physically, again, it was like, oh my God, it's really happening. But there was four people on my panel, and again, we had to give a presentation. So prior to that, again, the whole maybe like 6 months preparing for my interviews, I was really talking to dentists, I was talking to hygienists, I was talking to friends who I knew a couple of friends who were applying as well. So we would talk again how they were preparing, we would discuss what we needed to do. We would talk to different dentists, and I had them look at my statements and see if there's anything I was missing, any advice they would give me. Some were helpful, some were like, yeah, you've done well, no need to add. Some dentists would be like, have you looked at that? Look at this. Have you looked at this platform? Try and do that. So it was really good talking to different people. Everyone had their own different advice. And I always believe that. I believe in always, if you want to go somewhere in life, then it's best to ask people who have been there before. They'll tell you a lot. They'll give you, as long as you ask, definitely people are more willing to help. So yeah, that's why I'm really, I enjoy helping people. If someone wants to be a hygienist and they're asking me, I will let them know as much as I can. If I don't know anything, I'll be like, you know what, let's ask someone else. But everything I know, I'll be able to tell them, and I like it when people ask me questions. I think it's really good to be able to help others as you have been helped along the way as well. So yes, my interviews went well. We prepared for the presentation. I had to give a PowerPoint presentation. After the PowerPoint presentation, then they asked me loads of questions from each individual on the panel. They all asked their own set of questions. And then after that, they asked me if I had any questions for them. Again, I'd practiced that. I knew which questions I wanted to ask, and the scenarios, I'd already run that through my head. So I feel like I was well prepared for the interview. So I was able to ask them questions, and they answered me the way that, again, I was happy with their answers. And also what I did after giving the personal statement for the interviews, I also wrote a letter on top. I wrote a personal letter to the panelists, and again, I added that in my application. And I think again they seemed impressed, because after we finished the interviews, I handed each one of them my handwritten letter as well, and why I wanted to be a dental hygienist. And again, it was a little motivational letter that I'd written on top of my statement. So again, they seemed surprised, and I think that maybe went well, because yes, I got the place. So that was in 2006, I think. So then went into the hygiene course, and the hygiene course is very competitive, really, really competitive. People would say to me that, why are you applying? Why would they take you? There's only 12 places. Why would they pick you? But then I'd think to myself, why not me? They're going to pick 12 people from somewhere. So why can I not be that one of the 12? So it was all about really knowing that the course is really competitive, and you had to bring everything. If you're going for this interview, you had to bring everything. Make sure you're really prepared, because you might just get this one chance. So you've got to be really prepared for the course. In our course, they told us there was loads of people who had applied. I think about 200, if I'm not mistaken. And they kept narrowing it down, until finally there was about 12 or 14 of us. I think 12 that went through finally to make a course. And within the course, again, it was very competitive. Every week, every Friday, we had an exam, we had an examination every Friday. Sometimes we had a break, but every Friday, you're passing your exams, and that you're being kept on the course, you're doing well. Otherwise, you'd come off the course. They would literally take you off the course if you can't keep up with the academics. So then after qualifying as a dental hygienist, then I was able to come out, start working into practice, which was, I enjoyed it. It was wonderful because of the training we got. We were already seeing patients, treating perio patients in the end under supervision of your periodontists, of your lecturers. But we were still really, by the end of our training, we were comfortable seeing patients. So by the time you start working, you already feel really comfortable within your role as a dental hygienist. So yeah, that's how I qualified as a dental hygienist. And in 2015, I went back to university and I qualified as a dental therapist. With my training, I did both my dental hygiene training separately to my dental therapy training. So in 2015, I qualified as a dental therapist, and now I'm practicing as a dental therapist and a dental hygienist, and I really love my career. I enjoy what I do. That's why I'm always ready for, I'm available for questions. If anyone wants to ask me how to become a dental hygienist, I'm happy and willing to answer those questions, because as for me, joining dentistry was really by chance. I didn't set out to become, a dental professional, like I said before. It just happened because I met a really good careers officer. He is the one who really told me all about dental nursing, and that's how it started. And I'm really happy there's some career officers out there that, have helped, I'm sure have helped a lot of people find their passion or their career. So yeah, I hope you enjoyed the video. Please subscribe if you want more videos. Comment, let me know what you want to see, what videos you want me to do. And please, let's grow this channel. The more we grow, the more videos we'll make. And again, give me ideas. If there's anything you want to ask, perfect. Pop it on the comments and I'll make a video if I get loads of comments about that sort of subject. Thank you for watching and see you next time. Don't forget to subscribe. Bye.